Hello everyone, we're going to be talking about angina, myocardial infarction, and anticoagulants today for this presentation. My group members are me, Isaac Liguez, Taylor Butler, Devon Hagy, and Abby Gore. So first we're going to be talking about angina. Angina is classified as acute chest pain caused by insufficient oxygen to the myocardium. You can see angina in four various types such as stable, unstable, vasospastic, and silent. Stable angina is described as being predictable with the frequency, duration, and intensity. Usually this occurs from physical exertion, stress, and it can be relieved by resting. Some symptoms of angina are pallor, dyspnea, tachycardia, radiating pain to your left shoulder, jaw, or spine, diaphoresis, cyanosis, and then signs of impending doom or even sudden death. Some treatments would be organic nitrates, beta blockers, and even calcium channel blockers. So starting off with organic nitrates, you have two types, the short-acting and long-acting. Short-acting would be nitroglycerin, which is sublingual. So you're going to tell them to take 3 doses in 5 minutes apart for each one, but do not take more than 3 times. You would want to let them know that this drug is going to cause dizziness, and then also it's going to cause a throbbing headache because of the vasodilation that is occurring. For long-acting nitrates, you have isosorbide dinitrate, which is used for predictable angina. So this can be used orally or transdermally, such as a patch, and it's commonly used for heart failure. Some patient teaching for nitroglycerin is to make sure that they are not getting this medication wet, it's not heated whenever they're carrying it around, and that they are changing it out every 6 to 8 weeks, as well as knowing that once the sizzling effect is not present, then that means this medication is expired. For beta blockers, we have atenolol, metoprolol, and propranolol. Beta blockers are effective in stable angina, hypertension, and coronary artery disease. Some side effects with this are patients will experience bradycardia, they're going to be lethargic, have GI disturbance, and GI depression. A main contraindication is patients with COPD and asthma, as this can affect the respiratory system. Lastly, we have calcium channel blockers, which they cause vasodilation. They also relax smooth muscles, so this is effective with spastic angina, and they are also used for life-threatening dysrhythmias. Some examples of some calcium channel blockers would be amlodipine, verapamil, nifedipine, and diltiazem. Some nursing considerations for using calcium channel blockers would be to not administer this medication if the blood pressure is under 90/60 or if the heart rate is under 60. If this happens or if this occurs, then you would hold the medication and then you would call the provider. Next, we're going to talk about myocardial infarction. So this is most commonly known as a heart attack, and this is a complete occlusion of the arteries where the oxygen supply to the myocardium has been stopped. So if this occurs for over 20 minutes, the myocytes will begin to die. Some of the meds that we most commonly use for myocardial infarctions would be thrombolytics, and using the acronym MONA, so morphine, oxygen, nitroglycerin, and aspirin in the order of OANM, oxygen, aspirin, nitroglycerin, and then morphine. So some examples of a thrombolytic would be redoplase, alteplase, and streptokinase. So these are clot busters that completely dissolve the occluded arteries. These are usually given IV or a bolus, and they're most effective if they're given 20 minutes to 12 hours after the onset. Some nursing considerations for using thrombolytics is to monitor your patient's level of consciousness. This is because since they're clot busters, there can be an increased chance of bleeding in the brain. Lastly, we're going to be talking about anticoagulants, which these are most commonly known as blood thinners. So what this does is they reduce the coagulation or the time that it takes to clot, and also preventing blood clots, and also they can be used for preventing coronary artery disease, deep vein thrombosis, any MIs or CVAs. The three anticoagulants are heparin, Coumadin, known as warfarin, and enoxaparin, which is most commonly known for Lovenox. So starting off with heparin, we're going to be using heparin short term. So we're going to give it IV or sub-Q. These are most commonly used for deep vein thrombosis, embolisms, right atrial fibrillation, and we use it prophylactically, so preventing clots from happening. A major side effect would be a hemorrhage or the allergic reactions that can cause thrombocytopenia and thrombosis. Some nursing considerations are you need to monitor the patient's PTT levels, as well as not using any other anticoagulants, as there can be an increased bleeding. The antidote for a heparin overdose is protamine sulfate. So we have warfarin, which is also known as Coumadin. This is the long-term anticoagulant. And then, like we said, heparin is given IV or sub-Q. The difference is that warfarin is given PO. And then this med should be given daily until the therapeutic INR range is achieved. The antidote for a warfarin overdose is vitamin K, so your leafy greens. Some nursing considerations for warfarin is that this is going to turn the patient's urine red or an orange color. It's going to cause purple toe syndrome, and like we said previously, can cause bleeding. And then also making sure that you're educating your patient on any fall risk, blunt injuries, or head injuries, as if the patient falls, they need to seek medical attention, as there can be an increased amount of bleeding, especially within the head region. So lastly, we have enoxaparin, also known as Lovenox. So this is a light molecular weight heparin. As we said with heparin, it's given sub-Q or IV. Lovenox is given sub-Q in the love handles, or you can give it about 2 inches near the umbilicus. And then with Lovenox and heparin, they are intrinsic factors, so you're looking at the PTT, so you want to make sure that you're watching that therapeutic level. Some nursing considerations are to make sure that you're advising your patient not to rub the site of administration, and then also for them to report any blood in the urine, if they have any nosebleeds, or if they have any blood in their stool. So hopefully at the end of this presentation, you have learned a few things over angina, anticoagulants, and myocardial infarction. With that said, thank you for watching.